All right, so tell me your normal values of your pH.
7.35 and 7.45.
And every semester they put me in the same room when I'm doing ABGs, which means I don't have a board except way over here. I'm sorry. But at least I have some part of it open. Usually there's people sitting here and I have to make everybody move. All right, so what did we say? 7.35? 7.45, right? So anything below 7.35, what is that?
Acid.
Acid. So everything over 7.45, basic or alkalotic, right? So what about our carbon dioxide?
35 to 45.
What is it?
35 to 45.
35 to 45. So carbon dioxide is what? Is it acidic or basic?
Acidic.
It's acidic. So this is the one where you guys taught to flip it?
Yeah.
All right, so we're going to put down here, what are the numbers?
45.
45.
And 35.
45, 35. Just be careful when you do that because I'll tell you that I, at least one time during this lecture, will probably mess it up and say that it's low and point down here. So just remember that you flipped it. So this is our CO2. So what if the patient is hyperventilating? What's going on when they're hyperventilating? They're blowing off the carbon dioxide, so they're blowing off the acid, so they become alkalotic. And the same thing, the hypoventilation, they're not blowing off enough carbon dioxide, so they're holding on to all that acid, and that's when they get the respiratory acidosis, right? All right, so what about our bicarb?
22 to 26.
22 to 26. Where's bicarb made?
Kidneys, pancreas, and liver.
What did we say? 22, 26. So bicarb is basic, right? So I always think of like your baking soda, right? So what if you have diarrhea? It's acidosis, right? Because you are losing a ton of bicarb with diarrhea, so you become acidotic. Whereas if you're vomiting, you become alkalotic because you're vomiting all that stomach acid out, right? So you're getting rid of the acid when you're vomiting, so you have a buildup of bicarb or basic. Good. So we're going to do some practice. And there's no compensation going on here. This is just to get you guys back into the thought of doing it, right? So we have 7.31. Our CO2 is 52. And our bicarb is 24. So what do we have going on here with this patient?
Respiratory acidosis.
Respiratory acidosis. So bicarb is always going to be respiratory. And this is always going to be metabolic. And so whatever's on the same side as the pH is what we're going to say. So it's a respiratory because it's on the same side, and they're on the acidic side, so it's a respiratory acidosis. Everybody's with me to that point. I hate that I have to walk back and forth, getting my steps in there, y'all. Oh, the other one's already up there. So 7.53. Just getting the extra steps. All right, so 7.53. Bicarb is 32. And the CO2 is 42. What do we have there?
Metabolic alkalosis.
Metabolic alkalosis, right? It's on the same side as the pH on the alkalotic side, and it's the the bicarb that's on the same side, so that becomes the metabolic alkalosis. We're all good there. Please tell me if you're not, because I can do a few more of just the regular ones here. All right, so when we start talking about compensation, so let's say that one that we just had up there, right? The bicarb was higher than 26, and that pH was higher than 7.45. So what do you think your body is going to do to try and get that pH back in? Because where does the pH want to be?
Between 3.7, 7.35 to 7.
Right, we want to be back in that normal range, and like the perfect place that it wants to be is 7.4. So what is your body going to do to try and pull that alkalotic pH back into 7.4 if you already have a high bicarb and your CO2 is normal? How's it going to compensate? It's going to try and increase the acid, right? So it's going to decrease the respirations maybe. So the respiratory system can compensate pretty quickly. It takes longer if you have like a respiratory acidosis for the kidneys to compensate with that bicarb. So you don't see that compensation as quickly. Usually if there's any sort of compensation going on with the kidneys, it's been going on for a while for them to actually start compensating. But normally the respiratory system's pretty quick to, start adjusting your respirations to where it needs to be. So by compensation, what we mean is your body is trying to compensate to pull that pH back in. So it's going to start pushing your CO2 from that normal level out, right, to the acidic side. So when we talk about compensation, we should have our CO2 and our bicarb are both going to be out of range. So if it's a partial compensation, our pH is still out of range. So for a partial compensation, all three of them, none of them should be in the middle. They should all be out of range. So here's a practice one for the partial compensation. We have that 7.31 again. 52 and 28. So see, all three of them are out of range. But we know that the body has started to compensate because it's pulled that bicarb out. And we know that it's that one compensating because it's the one that's not on the same side as the pH. So we know that it's still, even though we have them both outside, we still know that he was in a respiratory acidosis because it's the one on the same side as the pH. And that the body has compensated with the bicarb. So we would call that a respiratory acidosis partially compensated. No, ask.
Come again.
Okay, so let's say that the 28 was in between and it was like 24. Okay, so this was over here at 24 instead of 28. That would be a respiratory acidosis. So your body, because it wants to pull this, so right now you're too acidic, it wants to pull it further here, so it's got to make some more base somewhere over there to pull the pH higher. So the way that it's going to do that is it's going to use the bicarb to try and pull from that 24. It's pulled now out here to 28, so it's made it more basic to try and pull this back in. So because this hasn't pulled back in yet, it's only a partial compensation. When we talk about full compensations, your pH will be back in here already. So as long as everything is out of range, it's only a partial compensation.
So it's going to be partial compensation pending, like, so because it's on the acidic side, so it's going to be respiratory acidosis with partial compensation for the metabolic.
No, you don't even need to say that. All you need to know is these are on the same side, so it would be a respiratory acidosis. And because this is out of range, just know that it's partially compensated. Yeah. Anybody completely lost? All right, so when you're fully compensated, it means that your body has done a really good job and it's been able to produce enough. If we had the same patient, maybe this has moved out further and this has moved this way further, and so now we're compensated. So our numbers, oh, we don't have numbers for this one yet. So our pH, I know. So our pH on here is going to be normal, within normal limits. But our CO2 and our bicarb are still going to be both outside of normal limits. So here's an example of this one. So we have 7.43, that's normal, right? CO2 of 54, and a bicarb of 35. So now the only thing that's normal is our pH. So we know that it's fully compensated something. Your body has done a good job. It's pulled, you know, the CO2 out far enough that it's got that pH back where it belongs. So remember I said it wants to be at 7.4? So that's going to be your marker to know whether or not it's an acidosis or alkalosis. So this one, because it's on the alkalotic side of 7.4, we're going to look and see what else is on the alkalotic side. So it's that base. So it's a metabolic alkalosis that's been fully compensated. Everybody kind of with me?
Got it. No. So essentially it's, I mean, you're figuring it out the same way, it's just that the margin of difference for this one is just, it's going to be smaller than.
The margin of difference
in the, in the pH. Like,
yeah, the only difference is the pH is going to be back within normal limits.
Within, but it's just a smaller.
But it's going to be one side or the other.
Higher than 7.4 or lower than 7.4?
Exactly.
Okay.
And that's what's going to make the difference, because that's when, otherwise, let's say it was at 7.4, which obviously we'll never do to you, but let's say it was 7.4, we'd be like, well, was it a respiratory acidosis or was it a metabolic alkalosis, right? Like, I know that it was one of those. So it's the pH that's going to tell you which one it was. It's going to be whatever's on that same side of the 7.4. So does everybody understand, like, the compensation and what your body is basically just adding acid or base to pull the pH in? And the way that it's doing that is through the lungs or the kidneys. You want to do some practice ones?
Yes.
I'll just give you some numbers and we'll let you throw them up there and see what it is.
Yes.
All right. I'm going to write them down because I won't remember the numbers that I'm just throwing at you. Oh, apparently I can't. All right, let's say pH of 7.38, CO2 of 47, and bicarb of 35. 7.38. Hmm? 35, the bicarb. And when you guys get your test going, when you sit down to take your test, I would write this stuff like in the corner of your paper when you start your test, just so that you're not sitting there trying to figure it out. So what is it?
Respiratory acidosis, fully
fully compensated. Make sure that you have the fully compensated, because what we'll do is, and there's a bazillion different ways we're going to ask you this stuff, right? So it could be that we just give you the numbers, and then you have A, B, C, D, and it's like, you know, all your different choices, your 4 choices, but it could say like partially compensated or fully compensated for some. We could give you a scenario, so we're going to talk about like what causes this stuff and what these patients look like in a minute. So if we just give you a scenario and say so-and-so was out drinking, she fell, she hit her head, now she's laying on the floor and her respirations are 4. You should be able to think through that and come up with what it was, but we'll talk about it in a minute. And so we might ask you that, or we might give you the numbers and we might say, so this is what's going on with your patient, these are their numbers, how are you going to treat them, what are you going to do for them? Or this is what happened to Annie on the floor with a respiration of 4, how are you going to treat her? And then you have to figure out what's going on with her and then know the treatment too, right? So it's not just memorizing numbers and having this chart. So when we talk about respiratory alkalosis, what are these patients doing?
They are hyperventilating.
They are hyperventilating. So they're just blowing off a ton of CO2, right? So you guys have these PowerPoints, I think, in the course, right? I know the course is. Are you guys able to get in the course right now? Oh, it's been down most of the day, so it's back up, I guess. But the PowerPoints are in there, but you can find these little things all over Pinterest too. So the respiratory alkalosis, these guys are hyperventilating. They're blowing off all their CO2. What are we going to do for them? But we want them to breathe slowly, yes. So we might give them maybe some Ativan or something to slow their respirations, right? Give them a bag because we want them to pull the CO2 back in, right? Because they're blowing it all off. So if we give them a bag to breathe into, they're actually pulling that CO2 back in. So yeah, definitely blowing into a bag. So if your patient is to the point where that person passed out on the floor with respiratory of 6, they're probably going to get mechanically ventilated until they can get them back to where they need to be, or that they're breathing on their own. A lot of this stuff is going to be compensating, so like the deep rapid breathing, that's going to be the body trying to, it doesn't say it up there. Some of them will say like the compensating what they would do. So. All right, so your respiratory acidosis. Did I just mess that whole thing up? What was the last one? Respiratory alkalosis, right? So the alkalosis, they're hyperventilating, not hypo. No, I was talking about your patient that hit her with their head and passed out on the floor and had a respiration of 8. I added in the wrong patient. That's what I did. So this would be that patient. Out drinking, fell down, hit her head, laying on the floor, respirations of 6. So they wouldn't be blowing off enough CO2, right? So they're holding on to it, so that's your hypoventilation. Overdose, increased ICP, anesthesia. So these are the patients that would end up mechanically ventilated.
So the other ones don't?
No, the other ones, I'm sorry, the other ones is the breathing into the paper bag. I was talking about the wrong patient at the wrong time.
That's because it says mechanical on the.
Yeah, I turned and saw the words. With the other ones, it said mechanical ventilation because it can actually cause respiratory alkalosis. The ventilation can, if we don't have the settings right, if the person, and that's one of the things when you have a patient that's ventilated, I'm sure, who went to the workshop today? Probably like half of you guys. Is everyone else going tomorrow? Did they talk about the ABGs and how they test them through, at least probably daily on a lot of these patients? No. So if you have a patient that's ventilated, they're going to be getting ABGs done, and you'll have to adjust the settings according to how the ABGs are coming back. Hmm? She did say that. And what she'll, Miss Hoffrichter is going to lecture on vents tomorrow, so we'll talk about it again too. So your COPD patients, your ARDS patients, pulmonary embolism, anytime you have something blocking the oxygenation in the lungs, you're going to have a respiratory acidosis. Metabolic alkalosis, these are the patients that we were talking about where they're vomiting. So they're getting rid of all that acid. Also, if you have your patients with the NG tubes, so we're sucking all that acid out of their bellies. So if we give you a scenario where your patient's hooked up to an NG tube with wall suction, continuous wall suction, you immediately should think respiratory or metabolic alkalosis because you're getting rid of the acid. Then your metabolic acidosis, these are your patients that are usually have diarrhea. All right, so let me bring up a website for you guys and we'll do some practices.